Keratoconus brings to mind stressful decisions, invasive surgeries, and poor visual outcomes. It doesn't have to be that way. So let's think outside the cone. Let's approach keratoconus like a refractive disorder with its own unique circumstances. Using modern-day technologies and techniques, and even combinations, let's approach keratoconus with its own unique situations and circumstances and aim for unaided emmetropia. In this case, we see a patient. I'm demarcating the cone area, and we have decided to proceed with the refractive laser technique, not Lasik, but a surface laser ablation called ASA. And using the excimer laser in a refractive mode in select criteria patients, we can actually aim to correct their refractive error, aiming for unaided emmetropia, as you can see in this topography here. These patients can actually achieve 20/20 and 20/15 vision, and I'm extremely pleased. In cases of keratoconus with corneal scars, we can peel these scars under the laser and proceed with refractive laser ablation as seen here. In cases of scars that have become an integral part of the cone, I laser through the scar, aiming for a refractive endpoint. Once again, a surface laser pattern, aiming for emmetropia. Collagen cross linking is a new advance in keratoconus where we can cross-link the cornea and strengthen it, and I believe this will be a great adjunct to most of the refractive techniques with keratoconus. In further ectasia, we can use Intacs by first making a channel in the lamellar cornea with a tiny slit incision. The intact rings can be inserted as segments, as you can see here, one segment. They act by flattening the cone into a dome, as you see here. The second ring is now being inserted. Intacs can be placed in various combinations of single or double rings, a large and small optical zone, as you can see here, for effective outcomes. Once the intact rings is in place, we can still enhance the vision by glasses, contact lenses, and even laser vision surgery. Once again, surface ablation techniques with the excimer laser can be used, like in this case with a single intact ring. This is a high mag picture, and we are planning an excimer laser refractive correction for the residual astigmatism on this patient who already has an intact in place to an emmetropic outcome. As you see here. In cases of post-LASIK ectasia, as seen in this clinical picture with the ectatic cornea, we can use sutureless lamellar corneal keratoplasty, single sutured keratoplasty, and even deep hand lamellar keratoplasty to build the cornea in various forms to provide thickness as well as improve the keratometry, as seen here in this topography. This can then be followed once again by surface laser refractive surgery to correct the residual emmetropia and astigmatism towards an unaided emmetropic outcome. Phakic implants like the Vision ICL, monofocal intraocular lens, Toric intraocular lens, and even piggyback intraocular lenses can be used to manipulate the optics of the keratoconus intraocularly, followed by surface excimer laser to correct the emmetropia for a great refractive outcome. So, for early keratoconus or advanced keratoconus or those associated with scars or cataracts, all these conditions can be approached with modern technology today to help these patients achieve the vision goal that they deserve.